stores everywhere. It's 1190 and the Dana Barrett Show. Proud partners of Pinner Productions Photography. Unique projects, unique experiences, unique photography. Get Pinnerized. PinnerPhotography.com. Now back to the Dana Barrett Show, right here on Biz 1190. It's Women on Wednesday, here on the Dana Barrett Show. And it's time for Vein Innovation's Vital Edge. Insight and innovation that helps you keep your edge at work and at home. VeinInnovations.com. Here now, today's Vital Edge.
I love when we have a new segment. Welcome back to the Dana Barrett Show. It's so fun because I always like to, the announcer guy, I've never actually met the announcer guy. I'm not sure he's a real person, but I always like to hear, his new introduction for a fun new segment. It's really cool. All right, before we get to Vital Edge, I just do want to mention that we have ATP in the house as well, and we're going to get to all things ATP later in the show. Jen White is here, one of our fabulous regular contributors, and now Jay Farrow, who just made it through Atlanta traffic, is here. He is the CIO of the American Cancer Society. So good morning to you, sir.
Good morning. Great to see you. Great to be here.
Always good to have you here.
Thank you.
So we'll let you breathe a minute and recover from the crazy Atlanta traffic that especially happens, as we know, when there's 2 drops of rain.
Serenity now.
There you go.
My serenity moment.
There you go. Yeah, there you go. Perfect. Also, so for Vital Edge today, Dr. Paul Cox is here, and you have kind of an interesting practice, not the standard medical practice. So I want to start right at the beginning before we get to some of the things you can do to help us be more vital.
Sure, yeah.
So tell me a little bit about the practice first.
We have, I think, was a very unique kind of practice at Oculus Longevity. I have a concierge primary care service, and we provide full spectrum concierge primary care for our patients. We limit the practice to 200 patients a year, and that's roughly about 1/10 of what the average primary care physician will see, which is 2,000 to 3,000 patients on their panel.
Okay.
All my patients have my cell phone number. They can contact me at any time. If they want to come in at any time, they just give us a call. My shortest appointment time is half an hour. The longest appointment time is as long as it takes to get done what we need to get done. And a vital part of that is the integrated medicine piece, which is where we approach medicine from the standpoint of optimizing the patient versus optimizing prescriptions. And that can include nutrition, that can include exercise, that can include changes in lifestyle. That often includes hormones as well, because I think that one of the most overlooked parts of medicine in the 21st century is optimizing our hormones before we start using medications to treat the symptoms of hormone deficiency.
All right, so I want to get to all of that because we were, of course, joking about the cat fight that I teased earlier in the show, and maybe some people needing some hormone therapy.
Right.
But before we get to that, and I didn't even tell that story, which I'll have to get to later as well. It's a pretty funny news story. Gotta love a good cat fight. Anyway, before we get into the hormone therapy, I want to ask you a little bit about the concierge medicine idea, because this is not a new thing. It's been going on for a number of years. I remember going to a doctor who I loved when I was in my 20s, who switched over to a concierge practice, and I just couldn't do it at that time. I couldn't afford it, and sort of felt like it was more geared towards older people. Is that true, or is it for anyone?
I think it's for anyone who's really and truly interested in being healthy and in taking a preventive approach to health. Unfortunately, what we get with standard of care medicine these days, in my opinion, is 20th century medicine. And so we get treatment by prescription with short visits, impersonal service, very little education for the patient about how do we keep you healthy? How do we keep you younger? How do we keep you vital? How do we keep your healthy edge?
Yeah.
And that takes a lot of time. And so the concierge model allows us to slow everything down and to really focus on the patient and focus on what is this patient's, what's their drive? What do they need us to accomplish for them today to make today's visit a success?
I've always talked about missing sort of the day. I've been mentioning this a lot lately for some reason, but sort of missing the good old days of like that family doctor who knew everything about you and really cared about you as a human being and came to your house and all of those good things. And in a way, that's why I love this whole Vein Innovation segment that we're doing, because Carrie, who's kind of cheerleading in the back of the room today, and I sort of came up with this idea along those lines to sort of help sort of get all that information together in one place for people, as opposed to having to sort of go find this and go find that and all of those things on your own, which is sort of how we are now.
Yeah, and the thing I tell people all the time, what I'm trying to do is basically take small town medicine back to the big city.
Okay, I love that.
I realized that when I went through medical school and through residency, I thought that I was going to go out there and I was going to make a difference and I was going to help people change their lives. I was going to educate them, and we were going to together make some great strides in healthcare. And what I learned was I was going to have to see 30 to 45 people a day, every day, spend 15 minutes with them, not have time to educate. And it got to the point where it was driving me crazy. And I had to say, stop, I can't do this anymore.
Yeah.
I just blew up my life. I closed my practice.
Wow.
And I said, I've got to do something different for my own health and for the sake of everybody else that I'm treating.
I love that. So I do want to talk a little bit about some of this hormone therapy stuff, and I'm going to throw this into the mix because I just like to do that. But
Sure.
one of the things, talking about concierge medicine, and I don't want to go down the road of insurance coverage and all that stuff right now, because
Right.
I think that's a whole other show.
Exactly.
Which we could do on another day.
Mm-hmm.
But I think that, for somebody, I'm a cancer survivor, and Jay knows that, we've talked about that many times as somebody who is, Mr. American Cancer Society over there.
Mm-hmm.
And so I have a cancer doctor that I feel like I have to keep going to. So
Sure.
how do you make it, if you're in a situation like that, how do you kind of make the decision to switch over to a concierge medicine situation, and then maybe I don't go to my same cancer doctor, I feel insecure about that. You know what I'm saying?
Sure, yeah. What I do is I'm your primary care doctor, so I would still continue. I would still say let's continue with your hematologist, oncologist, whatever. You continue that surveillance. But
Right.
I'm the quarterback. I help you. Basically, I'm the person who gets everything organized for you
Okay.
around that.
All right, fair
And so
enough.
you'll still see that oncologist.
So I wanted to bring up the cancer only because I'm cancer free right now, everyone, by the way. Like, so don't worry. No, but don't anyone panic. It's all good.
Right.
But I also wanted to just bring it up because as it relates to hormone therapy, I'm a breast cancer survivor, and one of
Right.
the things you hear all the time is don't do anything hormone related.
Yes.
Is that true?
It depends.
Okay.
For anyone who's had an estrogen receptor positive breast cancer, then yes, we generally say that estrogen isn't advised for any woman who's had an ER positive breast cancer, okay? For other women who have not had an estrogen receptor positive breast cancer, who do not have breast cancer, hormone therapy is a viable option. And what we have to really help people understand is that there is a thought process in America that hormone therapy is dangerous, that hormone therapy causes cancer, that hormone therapy causes heart disease, that hormone therapy causes strokes.
Yeah.
There's only been one study that shows hormone therapy is detrimental to your health, and that was with one specific drug called Primpro.
Okay.
That was a World Health Initiative study in 2002. The problem was in the medical community, we painted all hormone therapies with that broad stroke brush, and they're all not the same.
Okay. So it seems like one of the best. I mean, obviously, your practice is not about just like writing that prescription for hormone therapy
Not
and
at
sending
all.
you out the door. So
Yeah.
it sounds like monitoring and really knowing the whole patient is going to help make that decision on what will work and what won't.
Exactly. What happens when you come into my office, we offer a complimentary consultation. It's coffee break with the doctor. You can come in for 15 minutes.
I love that.
You sit down.
The only
you-
thing better would be wine break.
Exactly. Well, we do that afternoon. You come in, you sit down with me, you tell me what are your health concerns,
Right.
and I'm just going to be straight with you. I'll tell you if I feel like I can be of service to you for those health concerns. If we feel like that we're a good match together, we schedule an initial consultation, which, by the way, is going to take an hour or more. And in that initial consultation, I'm going to educate you about what your options are concerning that health reason. If it's something that you're worried about that could be hormonal, I'm going to teach you about hormones. I'm going to show you the actual medical evidence, the medical studies. I'm going to allow you to be educated so that you can make an informed choice for yourself.
Yeah. Yeah. So for people who either are afraid of it or don't want to do anything hormone related in terms of therapy, or for somebody like me who really can't,
Right.
are there other options?
There are other options.
And for what, like for this generic problem that we all have called aging, that's sort of what I'm getting at, by the way. In
Right.
case you're wondering.
Nutritional optimization can be super important. Lifestyle is also very important. And there are a lot of folks now who are looking into the fact of doing testosterone only therapy for women who have had estrogen positive breast cancer, and you do that in concert actually with estrogen blockers.
Interesting. Okay, but now I'm afraid I'm going to get a beard if I do
No,
that.
not at all. That's such a total misnomer. The level of testosterone that we use for women is about 1/10 of what we give to men.
Okay.
And so it's really completely different, but it does help with things like it helps with bone density.
Yeah.
It helps with energy. It helps with thought process. It helps with sleep. And that's the thing we really need to drive home for people. Hormones aren't just about your body. It's not just about looking good or having great skin or having beautiful hair. Hormones are about how you think. They're about how you feel. They're about your brain.
Yeah. Well, that's another reason we wanted to do this whole segment. And obviously, when we had Vein Innovations in 2 weeks ago talking about what they do, and it is all about, it's not just about your legs looking prettier. It's
Right.
about them feeling better.
Exactly.
And this is kind of the same idea. It's like if you're taking care of yourself, you show up to work shoulders back, chin up, you feel good, you're stronger, you don't get exhausted at 3 in the afternoon, or
Right.
you can't drag yourself out of bed in the morning.
Sure.
And so that's kind of the point of all of this. And, I love the fact that you're doing it from this sort of whole person perspective.
Well, and I love it. And there's one thing I can get people to understand. It's, if you are tired, if your memory is not so good, if you're not sleeping well, if you're apathetic, if your doctor suggested that you might need an antidepressant or something for anxiety, and you've never needed those before,
Yeah.
think about your hormones first. Before you blow up your life with a midlife crisis, before you visit that divorce lawyer, get your hormones checked.
I love
It's
it.
amazing how much difference it can make. And I have my own personal story that I can share with you when you come in and we sit down and talk.
Yeah. Well, we are out of time in this segment, but I'm not letting you off the hook.
Okay,
You're
great.
staying.
Thank you.
So we'll get more. We'll get more for sure. This has been our Vital Edge segment, though, and that's Dr. Paul Cox that's been talking with us from Oculus Longevity Clinic. Great stuff. Thank you so much.
Oh, thank you for having me.
But like I said, you're not off the hook. All right,
Great.
we're going to take a break right now on the Dana Barrett Show. We'll be back.
This has been Vein Innovations Vital
Full
Edge.
disclosure,